Okay, apparently I was a little long-winded on the first half of this, so to recap a little bit here on epididymitis and orchitis. I talked about I think just about everything we have on the slide here, and how orchitis can be a symptom of the mumps. Although the mumps is fairly rare anymore, it does certainly have some outbreaks where it'll pop up its ugly head from time to time. And trauma to the male genitalia. Obviously can be either blunt or penetrating trauma. Now, blunt trauma can lead to some things such as a testicular torsion. So once in a while you hear about that, people developing a testicular torsion as a result of their of either some, say, sexual activity or maybe from getting kicked or hit there. So occasionally we also have people who insert things into the urethra. That certainly happens from time to time. Occasionally we hear about people putting things like glass rods and whatnot, spokes to bicycle tire or bicycle wheels up there, so on and so forth. Not my cup of tea, but okay. Accidental self-induced result of sexual assault. Certainly we can have a variety of different mechanisms and manners how this can occur. In many cases it's probably due to somebody jacking around or being a guy and messing around with their buddies, or, hey, hold my beer and watch this. When you're a smaller kid, the gentleman of the bunch probably remember many times crashing their bicycle and having some injuries to their genitalia. Certainly tears or lacerations to the scrotum or the penis are a possibility. You hear about all kinds of potential things happening there, where anything from animal bites to jumping over a fence and whatnot. Occasionally you will have the testicle that falls out of the scrotum. Not terribly common, but occasionally occurs. Really working on trying to just control bleeding with that. And as we're going to learn in abdominal trauma, we're going to want to keep it moist and warm. So usually it means a sterile dressing, a little bit of moist sterile saline on it, and then you can cover it well to keep it moist. Try to control the bleeding as best as possible. Occasionally they also talk about using an ice pack. That may or may not be terribly comfortable for people. And then a fractured penis. The fractured penis occasionally occurs during vigorous sex, and in those cases the penis, it can't fracture in a classic sense because there's no bone in it. Some mammals do have a bone in their penis, but humans do not. But it fractures the chambers, the spongy chambers that swell with blood. So, and basically just trying to help keep it immobile, and usually the patient's going to do a pretty good job of splinting it himself. So, and how can you lessen the embarrassment of a patient with a genital injury? You'd basically need to just use some common sense. Remove all the extra people from the area. We don't need 16 people all in the same room while you're examining this person. Try to use the same sex EMT, respect the modesty, cover them up, so on and so forth. And then we can switch over to gynecologic disorders, which is the ladies' side of things here. And so you got to be careful. You got to be comfortable, caring, compassionate, knowledgeable. Provide the patient with privacy, because some of these are very, very delicate situations. So a A lot of times things that are very nonspecific because of the internal nature of most of the gynecologic anatomy being mostly internal, you have very vague problems such as abdominal pain. You may have vaginal bleeding or a discharge of some sort. And it's not as easy to visualize all these things. You want additional information on their menstrual cycle, their history, their pregnancy. Is there a possibility you can be pregnant? The only way they can possibly not be pregnant, and then they're in the, between, well, actually I shouldn't even say between menarche and menopause, because occasionally even then it happens. But, they're really between the ages of probably 8 and 68, is if they are absolutely positively have been abstinent for the last 10 months. So even though they're on birth control, even though they take precautions, there's still a possibility. So ask about pregnancies. Have you ever been pregnant? How many normal births have you had? How many children have you lost? Yes, it's not a comfortable question to ask, but it's a necessary question to ask. Are you pregnant now? Are you suspecting any issues? How many babies? How far along? More of those questions come along with the actual childbirth chapter that we'll get to. Ask about their contraception. What did they use? And then really most of what we do in gynecologic emergencies is supportive. There's not much we can do. All right. A few other things that kind of come around here. Pain with ovulation, something called Mittelschmerz. Another cool medical term, but Mittelschmerz is really just it's the normal ovulating process. However, in some ladies it is more painful, and so that is termed Mittelschmerz. May have ovarian cysts, which they start to grow a kind of a pocket of tissue within the ovary itself. Usually causes an increase in pain as well. Endometriosis and endometriitis. Endometriosis is an overgrowth of endometrial lining or tissue, and when it has a flare-up or they have a problem in which it's becoming extremely painful, it's referred to as endometriitis. Ectopic pregnancy, of course, is something we should consider. The ectopic pregnancy is when a pregnancy or an implantation occurs somewhere outside the uterus. Pelvic inflammatory disease or cervicitis. Pelvic inflammatory disease a lot of times is a result of sexual activity, where they'll develop a widespread infection in their pelvic bowl. It involves multiple parts of their reproductive anatomy. I'll draw your attention actually to a couple more terms that are in your text on 645. They don't get covered really in the PowerPoint here, but dysmenorrhea. Dysmenorrhea is pain or difficulty during their menstrual period, so maybe excessive flows and whatnot. Gravidity or grava is to be pregnant. Parity or para is how many live births a woman has had. So if a woman is pregnant with her second child and she has one living child, she is a G2, gravida 2, and P1 or para 1. She has one live child. She's pregnant with the second one currently. AB or abortion. The term abortion has been bastardized by mainstream society. Abortion, the medical term abortion, means ended pregnancy. It doesn't say why. It doesn't mean criminal abortion. It doesn't mean induced abortion. It doesn't mean medical abortion. It means the pregnancy ended prior to birth. So That's what but unfortunately that term has such a stigma to it, we try to avoid using it at least in front of patients. There's a video on the ectopic pregnancy. Vaginal bleeding, fairly common complaint for ladies with gynecological problems. May or may not be associated with pregnancy, may or may not be associated with their period. Trauma is also another potential, straddle trauma particularly, maybe even a sexual trauma. So an important question to ask them: how many pads, tampons, napkins, whatever, are you soaking in an hour's time? And how is that in relation to what your normal flow is when you have your normal period? That can help you gain some perspective. You know, I don't deal in those, so I don't speak firsthand on it. But I think in most cases it's probably, you know, 4, 5, 6 in a day during the heaviest parts of the flow. So, but again, I don't have firsthand knowledge. So look for signs and symptoms of hypovolemic shock. Yes, a woman can become hypovolemic from a vaginal bleed, particularly if it's something like a burst ectopic pregnancy that we didn't really know from the very get-go. And burst ectopic pregnancy can be fatal. So look for and treat signs and symptoms of hypovolemia. Sexual trauma, sexual assault. Cuts, lacerations occur from, say, straddle injuries. However, with sexual assaults, it's something you definitely have to always kind of keep in mind. Sometimes you don't even get the full story. If we're dealing with a potential sexual assault, preservation of evidence is going to be big. We're going to talk about that here in a minute. Our only thing we really need to do in cases like this is we're going to probably visualize it briefly to make sure there's no severe bleeding or anything else that needs immediate care. And the only thing we really need to do is control any external bleeding. We do not pack the vagina, so we're not going to be putting anything in there. You may also consider putting a cold pack to help reduce some of the discomfort or swelling, but beyond that, we're pretty much staying out of there. Males and females of all ages can be victims. So scene size up is going to be huge. Management of their primary, secondary, and their injuries is kind of normal. We have to take a lot of mental notes. We have to do a very good job of documenting because it's most likely going to be used as evidence. We're going to do the best we can to preserve the evidence. So in the cases of a woman that has maybe been sexually assaulted, we're going to ask her to not go to the bathroom, not shower, not freshen up or clean up anything, for the simple fact that there could be hairs, skin cells, sperm, so on and so forth, that can be used as evidence. Preferably, garments should be removed and then placed into a paper bag over plastic. Paper bag does a better job with DNA and biologics over time. Things like, you know, bullets and whatnot that have already been processed, yeah, those are going to end up in plastic for safekeeping, but the preferred initial container for evidence is a paper bag. In the sexual assault cases, we're going to have to consider the psychological aspect. We're going to have to be very cautious, be very respectful of our patients, reassuring. Don't make any statements that or don't ask the patients for various statements that imply fault. We're not law enforcement officers. We're not the ones that are going to do the investigation. We hate the situation. We may be mad as hell about it, but we are there to care for the patient's medical needs. We'll let law enforcement take care of the rest of that. Document anything that the patient tells you, though. If they volunteer stuff, that can potentially be used to assist them in their case later that the police and the law will raise. Document, document, document. All right, so it's just a summary of what we've done. Sexually transmitted infections, formerly called STDs, they're now STIs. It's kind of hard for most of us to kind of wrap our minds around because we're changing the terminology. But people with STIs are often ashamed of what's going on. They probably have a pretty good idea of what's happened, how they got this. They don't usually call for EMS, which thankfully we don't have to deal with it very often. They may delay their treatment at their signs and symptoms, thinking, oh, maybe they'll go away, or maybe they weren't sure at first. Somebody calls them up, tells them, hey, you've got this, here's the problem. You better go get treated and checked. So try to be empathetic, try to be non-judgmental, but there's nothing in these STIs that we can really do for them. It's all just their standard supportive care and transport them in. None of these are immediately life-threatening. I guess if anything, protect yourself. So 5 common STIs, they're pretty much listed on 647 in the second column there. Chlamydia, gonorrhea, herpes, syphilis are some of the most common. Of course, they consider HIV and AIDS in many cases to be an STI, but it's not exclusive to sexual transmission. And then the 5th one is the HPV, human papillomavirus. That's the 5th common STI. To just real briefly touch on those, chlamydia, most frequently reported STI in the U.S. Patients of either sex can have it. Usually have some discharge and some burning on urination. Maybe asymptomatic. And patients will usually complain of a watery discharge. Can be painful sexual intercourse, which that medical term is dyspareunia. And then abdominal pain. It's treated by an antibiotic and generally fairly easily treatable. Gonorrhea, second most commonly reported STI in the United States. Again, it's commonly younger males with a purulent or a pussy discharge and dysuria. Much more difficult disease to determine in women. A lot of times it will be asymptomatic until weeks later when they develop basically a different form of that disease. But it's going to be generalized weakness, fevers, chills, and they also will have a rash in many cases. It's also treated with an antibiotic. In most cases it's fairly easily treated. However, it does cause loss of vision in newborns, so a lot of times there's a screening process and routine eye drops that newborns will get, so they hopefully don't develop it. Herpes. Herpes is a very widespread and incurable because it's a viral disease, and it can take a week or so to incubate, and then you'll have an eruption of the vesicles, or basically things that look like little blisters on the genitals. Herpes is never fully eradicated, but it can kind of go dormant, and it will continue to pop its head back up from time to time as the body is under stress, and then that weakens the immune system. People can go on a couple of antiviral drugs, acyclovir, valaciclovir, to help treat their herpes. Remember, herpes, genital herpes, can become herpes simplex or herpes zoster, or herpes whitlow, in which you start to see that occur in and around the face. So yes, a cold sore is herpes. It's the same virus, it's just in a different area. Syphilis. Syphilis is the oldest documented STI. In fact, it killed off a lot of the Native Americans when it came over from Europe. But primary syphilis can last up to 6 weeks and presents in a basically painless ulcer on the genitals, something called a chancre. So it also has additional phases in which it can occur and can affect all different parts of the body, including the nervous system. Symptoms typically are general illness things, again, fever, fatigue, sore throat, hair loss, headache and muscle pain. They may also have a rash and a non-painful, non-itchy rash on the palms of the hands and or soles of the feet. Can help diagnose secondary syphilis. Tertiary syphilis, or the third phase, can return really at any time in the future, and it affects the nervous system. So it starts to destroy a lot of those. So latent syphilis will often disappear, and it just kind of sits in dormancy for some time. It's generally treated, again, with antibiotics. It's caught early and treated early. It's generally fairly curable. And then finally, the human papillomavirus. Basically, this is the virus that causes genital warts. But the virus can spread to all parts of the body. It's all papillomaviruses that cause weird things like little warts. It just depends kind of where you get it, the strain of it that you got, and how it's affecting. The disease is important because it has been linked to cervical cancer. There are some vaccines. Gardasil is the main one that has a couple of different strains in there. They're recommending it to young individuals basically around their adolescence, and boys and girls both, to help reduce the potential for cancer as well as spreading it. All right, so in summary, understanding the AEMT and the pathophys of the urinary and male and female reproductive systems is important for us to be able to associate with some of the symptoms we're seeing. Patients can experience acute chronic renal failure. Impairment of the kidneys' roles and homeostasis can lead to life-threatening complications. Patients with chronic renal failure receive hemodialysis or peritoneal dialysis to remove blood waste. Patients with significant complications related to shunt grafts and dialysis procedures. Urinary tract can be affected by UTIs, urinary obstruction, renal calculi. Care of patients with renal and urinary disorders is mainly supportive. Occasionally they will benefit from little IV fluids. Renal failure patients in cardiac arrest are managed the same as other cardiac arrest at the AEMT level. Paramedics may give a different drug and may give a calcium supplement for that, but interventions may be ineffective until we get some of that underlying abnormalities corrected. So we'll get some of the toxins taken out of there. Emergencies involving the male genitalia may be medical or traumatic in origin. They can be very emotionally distressing, resulting in permanent loss of function, occasionally life-threatening. Gynecologic disorders can present with various abdominal pains and vaginal bleeding. Obtain history such as pregnancy and menstrual cycles. Both males and females can be victims of sexual assault, and of all ages. You need to realize the emotional support, preservation of evidence, and then of course STI patients may seek pre-hospital care, but in many cases they don't.